Hi everyone, this is Bumblebee from My TV, My World. This video is one in a series in which I'm going to talk about concussions. I personally have experienced a concussion 8 years ago, and so this first video, that's one of 3 so far, I will be talking about the symptoms of what you may expect if you've had a concussion and you're new to this and you're not sure what's going on or what to expect. The second video I will be talking about things that help me, and the third video I will be talking about how relationships and decision making and other things can be impacted and how you can deal with that as best you can. So I am wearing this mask, as you see, because I feel more comfortable talking about these aspects of my personal life while wearing one. So I'm going to welcome you to my channel at this time, and this will be the beginning of the first video. So basically, I sustained a concussion 8 years ago during a bicycle accident. It was a very horrible accident in which I almost lost my life. Basically, I was just flown into the air several feet and I landed head first on the concrete. A concussion is a traumatic brain injury. It's a very serious injury. As you may or may not know, your brain is floating in cerebral fluid inside of your skull. And so this is like my brain, and it was floating, and then when I hit the concrete, this is my skull, it just mashed up against my skull, and then my skull of course hit the concrete. So I did sustain a lot of injuries from the concussion, because I still am having symptoms 8 years later. But outside of my brain injury, I sustained many other physical injury, like I broke bones and my teeth were knocked out, and skin was ripped off my face when I landed, and it was just horrible. But most things have healed for me, and I'm sure that they can, heal for you too with time if you have sustained a concussion. Also, this video is for people who maybe know someone who has sustained a concussion and they're not quite sure what they're going through and things like that. I hope to be someone who can maybe help walk everyone through this with my story. And if you have any questions or comments, that'd be great, because I'm really open to receiving those kinds of things. If you want to subscribe, or if you want to rate this video, that'd be great as well. So the first 3 years after the concussion, actually I'll go back. So right when the concussion happened, I was knocked unconscious. I don't even remember the whole ordeal, excuse me, but thank goodness there were a lot of people in the area who saw me flying in the air and didn't see where I landed, and so came to see was I okay, and I was unconscious, and they didn't know if I was alive or dead, and so they called the ambulance, which was great. I did know that I was alive, but I wasn't able to respond when I was unconscious. Of course, I was just in my own little world, I guess. I don't know exactly where I was, but I couldn't see or hear or smell or taste or feel things. I didn't have a feeling of happy or sad, with emotions, and also physically I couldn't feel like if someone touched my knee, for example. So I didn't have any recollection of where I was. So basically, when I was taken to the hospital, one thing that doesn't sit right with me was the fact that I wasn't given a CAT scan or MRI or an x-ray of my head. So there's no real way for me to know exactly what parts of my brain were affected, but it really doesn't even matter because I've been living it out for 8 years, so I really do know what parts of my brain were impacted. My first degree was in the medical field, so I do know quite a lot about the human body and about different treatments and all these things that can impact the body. So, but I wasn't in the medical field at the time of the accident. Otherwise, I would have requested an x-ray, of course. But anywho, over time, the skin grew back on my face and my bones healed, and, I went to the dentist to get some procedures done. But my brain was, I think, is the final thing that's healing, and it's taking some time. The first 3 years were the absolute worst for me. because I was experiencing some of the things I'm experiencing now, but I was experiencing more things too. The thing that worried me the most was my lack of response to people. I had a delay in response. It's like if you would be talking to me, I wouldn't respond to you. I just would not respond to you, because I couldn't formulate a response. My processing time would be so long. By the time I would formulate a response, you would be gone. And so, like, you would have moved away from talking to me. And so it wasn't just when people were talking to me, it was when life events were happening, and it was just so hard for me to process. And I was having these migraines all the time, of course, after the concussion. So that's what was happening, in addition to other things, the first 3 years. Okay, the next 2 years, because it's been a total of 8 years, so I'll talk about it the first 3 years, the middle 2 years, and the last 3 years. The middle 2 years were a bit better for me. Throughout these whole 8 years, I never really noticed that it was the concussion that was making me having a delayed response or having all these other symptoms. But in those 2 middle years, I did notice that a lot of things were different. I noticed things were different in the first 3 years too, but I couldn't figure it out because my brain wasn't, it was healing. It was trying its best to heal, and so I didn't have a lot of energy left for anything else. So I couldn't explain to you what was going on, and I didn't know myself. I didn't even know the right questions to ask when I went to the doctor. So if you're feeling very fuzzy and hazy about life, if you're trying your best to understand this video because maybe your brain isn't processing it, just know that other people have been through it too. I've been through it the first 3 years especially. But the next 2 years, I started going to healing groups and all these sorts of things. I started putting myself out there, even if I didn't know exactly what was happening to me. I tried to find some kind of answer because I was always in pain and I was depressed sometimes, and sometimes I couldn't feel things, and then I was still having delayed responses. These last 3 years, especially this last year, has been a lot better. I did make a list of some things that I'm still going through during this 8th year, just to give everyone an idea of where I'm at. I'm still having very severe head pain, like head pain that is debilitating. It feels like a train is running over my face, just ran on top of my face. Like, that's how it feels, if you can imagine that. I don't know, I'm trying to find the best example. Or if you've ever got your teeth pulled, just imagine getting maybe all of your teeth pulled at once without any medication. Just imagine that. That's how it feels for me still now. But on the side where I got, where I hit my skull, it feels that way, especially around my eyes. I'm still having nausea. Eating is still a challenge, but it's getting better. But sometimes I just have to make myself eat because I'm just having some issues there, but a lot of nausea, some imbalance still. It's really difficult for me sometimes to keep myself upright and to know, how I'm walking is okay. I'm traveling right now, which is awesome for me because I always wanted to travel to different places. But I'm on a hill where I'm traveling, so that's something that I'm always working on, is staying balanced while I'm on top of this hill where I am. Mood swings is something that I've been experiencing too. Crying spells, fainting. Fainting has only happened in these last 2 years. I'm not sure what's going on with that. Me personally, I would expect that to happen maybe the first year or something, but it's been happening recently where I would be awake and conscious, and then I would be down on the floor for minutes or sometimes for hours and have no recollection of that period of time, and not even knowing why I fainted. So myself and my physician are watching that. Sensitivity to light, sound, and smells is a huge issue even now. The fluorescent lighting and the sunlight, sometimes I can't stand it. Sometimes I have to just close the shades and then just turn all the lights out and have no noise because it's just too much stimulation in the environment. And then to smells too, and then to sounds. So that's some things that I've been experiencing this eighth year, but it has improved for me because I'm able to remember things and to concentrate and things like that. So this is my first video, just to give everyone an overall maybe like a guide as to what you may or may not experience after a concussion. It all depends on you, because every person is different, right? And all of our brains are different. And the accident that everyone endures, if you endure a concussion, those accidents are different. Mine was a bicycle accident where I flew in the air and then I landed on my skull. Yours could be maybe you were, playing football, or you're playing hockey, or you were doing something else and you hit your head. So just don't rush yourself, but just know that every incident is different. And even if, we've all had concussions, everyone who's watching this video, my sensory of pain will be different than yours, right? We all have different playing fields for all these sorts of things. So this is just, an informational guideline to what I experienced post-concussion for 8 years now. So I hope that you find this video educational, and stay tuned for my second video where we'll be talking about things that have helped me post-concussion for the past 8 years. So stay tuned. See you later. Bye.